My name is Dr. Kristen Higgins, and I'm a thoracic radiation oncologist at Winship Cancer Institute of Emory University. I will say there are a lot of different abbreviations for the different types of radiation that we use, and I think it can sometimes be confusing to our colleagues in other oncologic disciplines, but I'll try to give you a short and concise explanation for what it means. So EBRT stands for external beam radiation therapy, and what it refers to is a patient coming in and getting radiation on a linear accelerator, as opposed to something that is called, brachytherapy, where a radioactive source is implanted inside of them. There are different types of EBRT. That includes something called 3D conformal radiation, also intensity modulated radiation therapy, also volumetric modulated arc therapy, or VMAT. IMRT and VMAT are really one and the same. And those are all ways to deliver EBRT. The most conformal radiation is VMAT or IMRT. 3D conformal radiation is the radiation dose does not conform quite as well to the target. So generally, when we're treating lung cancers, we try to use IMRT or VMAT for a patient that has a curable lung cancer, so we can make the dose to the tumor as conformal as possible. EBRT is also different than proton therapy, which you would typically abbreviate as PBT, or proton beam therapy. So in summary, external beam radiation therapy refers to radiation that is delivered with photons using a linear accelerator platform, and that's the most common type of radiation that is used in cancer care. So EBRT is used frequently in lung cancer patients. For stage 3 non-small cell lung cancer patients and limited stage small cell lung cancer patients, we use typically IMRT or VMAT to deliver curative doses of radiation to the tumors in the chest and the lymph nodes that are also involved. We will use 3D conformal radiation for palliative treatment of metastatic lesions, for example, bone metastases that are painful. Also sometimes tumors in the lung that are compressing the airways or the esophagus. We also will use more technical forms of external beam radiation on a linear accelerator for stereotactic treatments. And that's sort of a different broad type of radiation. It's still delivered on a linear accelerator, but the target is localized in 3D space, and we're able to give very high doses of radiation to small targets in the brain, the chest, and other areas throughout the body with these different types of stereotactic treatments.